The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees. Now, time for a break with Central Illinois' own Gretchen Wirtz.
Welcome back to Central Illinois Newsday. I'm Gretchen Wirtz, and today we are back in East Peoria here at 1 Degree Functional Health with Dr. William Weinman. Thank you so much for having me back.
Thanks for coming.
I love this place here. This is really nice. This is a new building for you, about a little over a year now, right?
Yeah, want a bigger building to help more people. Yeah.
That's perfect, yes. And you help people here. Neuropathy. You became board certified in neuropathy. A personal story, I guess. You and your dad kind of both things kind of triggered you to kind of change paths and dig into what this is all about. And today we want to talk about, so people come here for treatment, and you've got a lot of different equipment around here that we've been looking at. Is any of the, so when you're treating neuropathy, is it painless, any of the treatment that you're doing, or how does it?
Yeah, it's all painless. No pills, no injections. We actually want to make sure we actually heal the body naturally, so we use very specific equipment that's FDA cleared and researched. And so it's actually helping re-educate the nerves and blood vessels is what we're looking to do for most patients.
So I know, like, stimulation, nerve stimulation, but none of that doesn't hurt or tingle or just...
No, it's all based on, and some people can't even feel it with neuropathy.
Really?
And so that's the downside. Like, I could have the machine maxed out and they can't feel it. And so we got to make sure where the patient's at to determine what the patient needs for actual treatment. And
that's why it's so important to come in and get that first evaluation done. And you said a lot of people, they put that off. They deny that they have an issue, or they put it off something else, or they take a pill and try to
so like me, you keep thinking, well, if I don't do anything about it, it's going to go away. Well, it doesn't, because I know that, and it only gets worse. And so the key is the sooner we get to it, the easier it is to help. The longer you wait, sometimes we can't reverse it or help it, and that's the downside of waiting. So if the damage gets above 85%, that's kind of the number where we see where you may have disability or some kind of problem you can't reverse.
You cannot re-educate.
So the sooner the better.
At that point. Okay. Yeah. And we're talking about mostly like extremities and the fingers and the toes. Anywhere else that it could be?
Feet and hands are the most common. I've even had patients with strokes that have had some different issues, but we want to base it on the patient itself. Okay. And so based on that, but it mostly is feet and hands is what we see. Is
what you see. And you kind of broke it down, and there's 4 different types of neuropathy, I guess, or 4 different reasons that people may have.
Well, it's actually over 100, but the ones you see the most common are chemo and radiation. That's a very big one that causes damage. My youngest is 19 that had that. Diabetes is a very common one. And people always say, well, I don't have diabetes, why do I have neuropathy? That's what's confusing to people. Yeah. Because you can have damage in the nerves and not know it. I've had farmers with toxins they've been around, people in the military with toxins, same with myself. And then you have people that have had just back surgeries that failed, or multiple back surgeries.
Multiple, that was
that's a very common.
To hear too.
Patient today, 3 back surgeries, that's what cause really is neuropathy.
And it's just because they've cut in and exposed that so many times?
Over time, a lot of damage to the tissues, scar tissue, and lack of blood flow. That's a big one that people miss. There's a lot of constriction and inflammation in the blood vessels.
What can people do at home to maybe not prevent it, but be, I know, healthy, but is there something key that helps with preventing neuropathy or keeping the blood flow strong?
The downside of neuropathy is what we see is it gets to a certain percentage, the body is now breaking down faster than it can heal. That's what's so dangerous about neuropathy. And a lot of times you don't even know you have it, like my dad. Right? Yeah, a little bit of numbness, just thought it was maybe some sciatica he'd had in the past from his back, and then when he woke up with drop foot. So it's so dangerous to know, and that's why our first goal is to determine, is it neuropathy? Are you in the right office? Because if you're not, I'm going to send you somewhere else. But if it is neuropathy, we're going to figure out, okay, what's the game plan for you? What do we need to do next to help it? Because it only gets worse, and as it gets worse faster and faster and faster. That's the downside. And you said,
like you said, there's a couple prongs to it too. I mean, it's healthy, making lifestyle adjustments maybe too. I mean, you can't just come in here, it's not just a miracle, and you can't just sit still and...
Yeah, patients have to do work, and I have a very serious conversation with them. I won't take people as patients if I don't feel like they're going to do the work, because we just want people to get results. Right. And based on how bad you are, I'm going to sit down and tell you. And that's the key, is if you're going to do the work, that's how we get the good results we've seen. You can go to our website and see those people. And if I can just get any hint, if you're purple feet and you're diabetic, you may have to do some serious work with your diet, but it's all based on what do we give the body to actually heal itself. So that's the key.
Okay. For someone that has like a minor, can you go through treatments and re-educate the nerves and be okay and not have to do any maintenance, or is there always going to be some sort of maintenance to?
That's all based on the exam. It's hard to say without knowing what kind of neuropathy and how bad it is. Chemo and radiation, they may have to do some maintenance. But the thing is, Rachel is one of my testimonials. She could go again to the water park in Wisconsin Dells, and she was super happy because she couldn't do the stairs. That's how bad her balance and her weakness in her legs. And now If she has to do maintenance, she's okay with that. And so she's like, whatever I have to do to maintain it, but it just gets easier and easier.
Right, as you go on.
That's the key.
That's the key.
Yeah.
All right, well, very good. And of course, we want our viewers to know that the first 25 viewers here right now, for $49, you can come on in and get that full neuropathy exam, and that's going to get you on the path here to getting better, and that's what we want you to do. So come on in here and see Dr. William here, 1 Degree Functional Health in East Peoria. You can call the number 309-790-3009. Call right now today. Thank you so much. All right, more coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.